Hello everyone. This is a SWOT analysis regarding health information exchanges in the rural areas, and in particular how it affects our area with seasonal workers and visitors, meaning seasonal increases in the population. So what are the strengths? Our strengths are quality healthcare outcomes, interoperability for providers, and reduced fragmented care. Let's take a little bit more in-depth look. This means a green system, less paper storage, reduced record-keeping redundancy, improved data billing for billing and services, accuracy, reduction of fragmented care, improved quality patient outcomes, quality patient care and outcomes, quality public health care outcomes, and greater interoperability between providers. Next, we look at weaknesses. What are some of the weaknesses? Well, it could be lack of necessary equipment and hardware to appropriate for electronic health record implementation for health information exchanges. It can be time-consuming and difficult to link the information contained in legacy systems to that in new systems. And it can increase the workload of a healthcare provider, especially in smaller rural areas where there aren't as many resources. There could be creation of clerical typing problems, maybe not see a return on investment right away. It could impose more discipline and control on employees. And there could be a possibility lack of adequate staff and culture of resistance and pushback to a health information exchange. But let's look at the opportunities. The opportunities are improved patient-centered care throughout the community, improve public health surveillance efforts, and develop more responses to public health. And what do those opportunities look like? Well, there could be more rural and seasonal patients participating in their own care. There's going to be a sharing of information between healthcare providers and patients. There will be improved health data for seasonal workers and seasonal visitors, improved health surveillance for residential rural population in the event of a disease outbreak. And there's going to be a primary source of training for physicians and providers of public services. It will provide an efficient access to a variety of health statistics for a rural public health crisis. Efficient reporting of surveillance in real time is a great opportunity. So let's look at the threats. Threats are physicians and provider resistance, lack of funding, lack of expert human resources. Physicians and other clinical staff might provide resistance in use of electronic health records. There could be lack of funds for the design and implementation of health information exchanges. Lack of expert human resources. We do need trainers to train everyone on how to adequately implement this. Unauthorized access to patient information, meaning security and breach of data, is a big concern. And there is a limited awareness of healthcare providers about the benefits of electronic health records and health information exchanges. And there's still also an absence of national standard vocabulary for the establishment of electronic health records to provide for continuity of health information exchanges. Thank you for listening, and here are the references.